Hello, you're watching Health Day Now. I'm Mabel, Jong. Solutions for health equity, new guidance for a heart healthy diet, and the use of precision medicine in heart failure were just some of the topics on the agenda for the 2021 American Heart Association Scientific Sessions. The meeting was held virtually for the second consecutive year. For the most significant takeaways from this year's sessions and how they could potentially affect you is cardiologist Dr. Manesh Patel with Duke University School of Medicine. He is the chair of this year's scientific sessions. Dr. Patel, great to see you.
Yeah, thanks for having me.
What were the themes of this year's sessions, and perhaps name your favorite presentation?
Well, thanks. I think every year there's the scientific sessions for the American Heart Association are fairly dramatic because it is the opportunity for us to, under one large tent in the American Heart Association, see all of the science and the young investigators. This year's theme was One World Together for Science. We're very cognizant of the fact that over the last 2 years coming out of the pandemic, we're all working together to better understand how we can improve human health, not just with COVID-19, but overall. The other big theme, which is tied to the mission of the American Heart Association, was to, see how do we get to a world for longer and healthier lives for all. And that really has a strong health equity message because the last few years have taught us just how inequitable health can be. And so the sessions also had another through theme of how do we get closer to people? How do we include them in science? How do we get health to our population?
Yeah, I want to get back to the health equity in a little bit, but what do you think the average person should know? What kind of information can they take away from this year's sessions?
Yeah, from the scientific perspective, I think there's some really impactful science as always at the American Heart Association. And sort of to give you the breadth of the things that I think are going to be in practice this week. I was at the sessions yesterday. I was actually in clinic this morning, and there were things that I was learning at the sessions that are affecting how I care for my patients. And some of those things include the sessions this year actually had a dramatic amount of cardiothoracic surgical science. People that might be having the need to go through a cardiothoracic surgery. What are some things we need to understand? Those are very technical thoracic surgery studies. There are also really impressive studies on how do we manage blood pressure. Large study out of China showing that village-led doctors, not official physicians, but really local sort of medical practitioners with physician backing or pharmacy backing, randomized 300 and some villages and showed that those villages that had that intervention for local blood pressure control and treatment significantly reduced blood pressure, 15 millimeters, a huge reduction that likely will lead to cardiovascular event reduction. So we've really seen some really interesting blood pressure research coming out of China over the last several months. A salt substitute study where potassium was substituted instead of sodium chloride and reduced not just blood pressure, not just stroke, but cardiovascular mortality. And then this study showing blood pressure reduction. And then we saw a session that had our colleagues from Boston and the Boston area with a large hospital system, different than the Chinese study where they use a lot of different resources, blood pressure cuffs, pharmacy-led, again, calling patients directly, both cholesterol and blood pressure being managed, and showed those that could stick with it could reduce it. So I think really good studies on surgery and interventions. And finally, I'd say really innovations in some new drugs for blood pressure and heart failure, really, and diabetes. These SGLT2 inhibitors continue to show us that they can really be beneficial in patients that have heart failure and diabetes. So a broad spectrum of what I'll say, large studies that will affect our practitioners.
Do you think these are the areas of research that will continue to see more attention paid to, or do you think there's more work that needs to be done in some areas?
We are going to continue to see really breakthrough technologies, some of which we're learning from COVID. We had a vaccine session with the CEO, Nancy Brown, when we talked to the CEO of Moderna and the chief scientific officer of Pfizer. And, they're thinking through how those technologies also potentially affect the cardiovascular system. What are targets both for heart failure, for cholesterol, for cardiometabolic syndrome that they could be attracting or targeting? And so I think the AHA will continue to bring forth a lot of that sort of what I'll call life-changing science. And to be honest, we're never sure exactly all the targets because there's so many great minds doing it, but they'll likely be aimed at the biggest conditions, which are, as I said, high blood pressure, heart failure, and stroke.
During the pandemic, a lot of people weren't able to keep their blood pressure in check. Perhaps they wouldn't or couldn't go to their doctor. How did that impact people this past year and a half?
Yeah, another really important study in that same hypertension session I talked about, and others that have described that, is that unfortunately, we had made significant gains in a lot of places until about 2010. And Don Lloyd Jones also highlighted that, for 70 years, we've been making significant reduction in cardiovascular death. And then it started to flatten somewhat around 2010. And in this last 2 years, then COVID hit, we've seen even worse blood pressure and what I'll say risk factor control.
What additional evidence did we see that people from diverse racial and ethnic groups had more heart events related to COVID infections? And also, I want to ask you, you guys set up a goal of 2024 to advance cardiovascular healthcare for all. How does the AHA propose to break down the barriers?
I mean, I'm proud to say that the AHA has significantly invested in a variety of things to try to better understand the science and the ways to break down their barriers. Just announced is an American Heart Association strategically focused network on including more diverse populations in clinical trials. So that $30 to $50 million effort will be aimed at understanding what is the science of getting different populations of people into trials to better represent the people we care for. Additionally, the American Heart Association, and at the sessions, we had a whole thread of health equity, including achieving health equity and advancing solutions. And in that session, there's a lot of conversation both about the scientific infrastructure, but the infrastructure our communities have to do to invest locally, to think about what the community health centers can do and what the community hospitals can do. In fact, in that session, it was pretty powerful that there were sort of three broad sort of messages. From last year, there was a phrase that Tom Ford used, which was, your budget is your moral document. Where you spend your money is what you care about. And we all do that in our home. And you can imagine that as businesses and as health systems, we do that. And the American Heart Association is spending a large amount of their resources in this year coming out of the pandemic into trying to understand the science behind disparities. The second statement was, if you don't measure it, you can't fix it. And so, we all talk about it, but if we're not measuring the disparities, we can't then try to address them. And so that was Sonia Angel nicely did that. Her other statement was, instead of mitigating it, we want to eradicate it. So what are the root causes? And finally, as somebody at an academic health system, some of the conversation was, you can't ask somebody to fix it in their house until you fix it in your house. And so broadly, for health inequities, we all have to start leading by saying, what are the things we're doing to make health equitable in our local region?
I'd be remiss if I didn't ask you about this new diet that you guys are really supporting. A first time in 15 years, you guys changed your guidelines for a heart healthy diet, really focusing on patterns, not specific foods. You want to talk a little bit about that?
The first sort of 10 rules was, energy balance. You have to think about the fact that you have to spend as much or more than you take in. Otherwise, over a lifetime, you gain weight. And even though that sounds very straightforward, that then leads to, can you get into a habit of activity? Can you get a habit of understanding what your daily weight is? Can you get into a habit of watching what you eat and how much you eat and understanding that pattern? The second is much more of a pattern towards plant-based foods. And we recognize we all like meats, but the plant-based foods are certainly healthier on a variety of nutritional value, but also on making people feel full and thinking about ways in which you can get that. The third one was, of course, around meats. If you're having those, to try to get towards lean meats and other actions like that. There's a whole section on behaviors around activity and eating and sources of proteins and fibers. I think most of it, I would say, are things people think about, but putting those habits into action are going to be important for sure.
All right, Dr. Patel, we thank you so much for your time today.
Well, thank you for having me. And again, thanks for all of you checking in on the American Heart Association Scientific Sessions 2021. Hopefully you'll be able to log in and see some of it.
All right, cardiologist Dr. Manesh Patel with Duke University School of Medicine and chair of this year's Scientific Sessions. I'm Mabel Jong. You've been watching Health Day Now.